to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Thanks so much for tuning in. Tonight we are talking about the ins and outs of TB testing. In studio is ExpressCare's Dr. Jitka Lom. Let's get to some questions from our viewers.
Sure.
So one viewer asks, how do you treat active TB?
So active TB is when the person's already ill. TB is a difficult bacterium to kill. You have to take 4 different kinds of medicine for a minimum of 6 months, sometimes 9 months, and sometimes 1 whole year. But at least 6 months of 4 medications to kill that thing. And at the beginning, when you're active, you have to actually be in quarantine so that you don't make other people sick. How do they know when you can get out of quarantine? When they check your sputum. They check your sputum to see if there's any more bacteria growing in it. And it takes a while to grow that bacteria out. So if you cough in the cup and then they send it to the lab, it may take 2 weeks up to a month for them to get you the results back to see are there any bacteria there. So typically people will be in quarantine for anywhere between 1 to 2 months.
Oh, wow. Okay. Now, should I get a TB test if I'm pregnant?
Yes, it's part of the prenatal screening because we want to ensure that pregnant women stay healthy. And when you're pregnant, your immune system is a little more sensitive. So this is one of those times where if you're a positive TB reactor, your TB could wake up and hurt you. So that's why we do test women for TB during the early part of their pregnancy.
Okay, so another viewer asks, if I had TB, can I get it again?
Yes, you can. So here's a couple of things. So if you take that person with, let's say, just a positive TB skin test, but they are not sick, and they take their 9 months of INH, meaning they take the preventive medicine so that later they don't get sick, are they in the clear? Well, probably, but we still want them to get a chest x-ray every 5 years because it's not 100%. It's about 80% that they'll be okay. But about 20% of people can still get sick. Now let's say they have active TB and they're taking the 4 medications for that 6 to 9 months. They finish their medicine, they feel a lot better, everything seems to be okay. They definitely need a chest x-ray every 5 years or sometimes a little bit sooner because about, depending on the person, somewhere less than 5%, maybe 3% of people will have a recurrence of their TB. The most difficult problem is when people haven't finished their medicine because it's a big effort. You got to take a lot of pills for a long time, and sometimes people drop out or move or you know, get lost to follow-up. And then they've partially treated their TB, and this is the worst situation because then you get a multi-drug resistant TB. And in the world, this is a huge problem now because, especially in developing countries, they don't have public health to really keep on top of people. People start feeling well after 2 or 3 months of their medicine. Like, you know, I don't really need to finish this. And their weak bacteria have been killed off and the strong ones have survived, or they multiply, and the person can get really much more severe TB. So there's about 10 other drugs that they can be on to try to kill it. But worldwide, the multi-drug resistance TB is the one that is really killing people.
Okay. Now, a viewer is asking, how many people actually die from TB?
Well, I think that about 9 million people per year catch active new cases of active TB in the world, and of them somewhere around 2 million will die. And that's a lot of people. In developing countries, who's at risk? The weak, the young, the sick, the malnourished, the HIV people. These are the people that are at the highest risk of death. And so this is why, for example, the Bill Gates Foundation and the Global Fund, it's called the Global Fund, is targeting malaria, AIDS, and TB because worldwide it is one of the big killers of people.
Okay, so obviously getting tested for TB is of extreme importance.
It really is on Guam, yes.
So where can a person go to get TB testing?
Well, most clinics will offer TB testing. Certainly public health will do it. Of course, it's a requirement for school-age children and teachers and anybody who's really in any situation where they're working with the public. But anybody who goes to see a movie, you know, a long movie, a 3-hour movie, or takes a long flight out of Guam where you're in the plane with people who are perhaps coughing or whatever, it's a risk just by living here. So it's really a wise idea every 2 or 3 years at least for other people to have a TB skin test. We do offer it at my clinic. It's still only $25 for peace of mind.
All right. And now I understand that, TB tests are one of the key requirements for students going to school.
Yes.
And that is usually done on a yearly basis. Is there a
Yes.
reason why that's done on a yearly basis versus, the 2 years that you're suggesting?
Right. So it's actually a great question. Actually, if you're in the same school and there's no active cases of TB, you may go for quite a few years and not have to have an annual test. Oftentimes, children only are tested when they're going into a new school. But here's the reason. Let's say if a child was exposed to TB today, their test will be negative for a while because your body sees the bacterium, but it takes it a while to produce those antibodies. And the bacterium is slow growing. So it may be 3 or 4 months before you turn positive. So let's say if there's an outbreak of TB and you have a TB test today and you're, whew, I didn't catch TB from that active TB person, that's good, but you want to repeat it again in about 3 to 6 months to make sure that in that window of time, it doesn't turn out that, yeah, you actually did catch it.
Okay. Now I understand that there's TB disease and TB infection. So what are the difference between the two?
Right, so that's what we're talking about as far as the illness versus infection. So you can be infected, meaning like you're a carrier of the bacteria, but you're not sick. That's when you have a positive TB test and a normal x-ray and you feel perfectly fine. The only thing that's not normal is that you have a little red mark on your arm. Okay, that's just infection. Then you'll take your medicine for 9 months, you'll be okay, get an x-ray every 5 years. Illness, active TB, is when you have symptoms. The most common symptoms are when you're coughing and you're feeling sick and weak and tired and losing weight and having fevers and night sweats. But you can also have other symptoms that are, for example, pain. The TB can lodge in people's spine and give them back pain or neck pain. Recently I had a patient who had an abscess that was a TB abscess actually in her lower pelvic area, which is very unusual, but it can happen. So typically TB will lodge in the lungs. That's the most common place, but it can also be in other places.
All right. Thank you, Dr.
You're
Lom.
most welcome.
Well, thank you so much, Doc, for your expertise.
Sure.